Welcome to this week's podcast of Kicking It with Kidneys with your host, Cindy Barclay. Hey, Cindy, take it away.
Hello out there, and welcome to our first podcast, Kicking It with Kidneys. I am your host, Cindy Barclay, and we have an exciting show for you today. One of my favorite dialysis entrepreneurs is here today, and longtime colleague, Marion Wilson. She just popped in just to provide her expertise on the subject matter in discussion. Today, we'll be talking about COVID-19 within the dialysis population, talking about how many Americans have and have not been vaccinated. There are approximately 330 million people in the United States. Based on the CNN polls, as of yesterday, year to date, we have vaccinated approximately 13.5% of the U.S. population. The polls also show, however, that 36% of the patient population do not even want the vaccination. Now, I guess I'm a little concerned because when you talk about dialysis and dialysis patients, there are approximately 7,500 dialysis centers in the United States, 600,000 patients that are undergoing dialysis in the United States. If you do the math, 600,000 divided into 330 million, Marion, wouldn't that put you about 0.00018%? Okay.
Very low.
So I guess what I'm thinking about and why I'm wondering, since the population is that low, why aren't there more patients that are vaccinated? We have no data today. Okay, there is no data on this. So why aren't we capturing this information, and why aren't more patients vaccinated?
Well, I think that people are hesitant to receive the vaccine for a couple of reasons. But I think one of the bigger reasons that needs to be considered is when you look at the population of individuals that receive dialysis services, it's largely minorities.
Okay.
And so in this country,
When you say minorities, large minorities, you're talking about
African Americans, when you look at the population of those individuals that receive the services, it's a large percentage of those are people of color.
And why is that?
Well, I have my thoughts. I believe it has a lot to do with our lifestyle choices.
Okay.
But I think that because of the history in this country with vaccines, people of color receiving vaccines due to some events that took place in this country, people of color have
Talking
issues.
about the Tuskegee experiment?
Yes.
Okay.
That caused people to be very concerned, and it causes individuals to not be so trusting, not to be in such a hurry to receive the vaccine. And so I think that is part of the reason why we haven't seen a large population of the dialysis patients go for vaccination. There's some.
Well, don't you think that's just an excuse? Now think about it.
Well,
when they vaccinated those folks, those were just black folk. You're looking now, based on CNN data, you have more white people that are vaccinated than black people.
Right.
So if the white folks taking the vaccination, why don't you trust, or why don't black folk trust?
Well, again, just speaking on history, those individuals that participated, they thought that the playing field was level, and that that all the participants were receiving the same treatments.
Okay.
And they later learned that to not be true.
Okay.
And so
that's where the hesitancy is.
Yeah. And I mean, rightfully, you can understand why people would be not in such a hurry, because this is a very new field. It's evolving. In the outpatient setting, because the patients are there for extended time periods, it gives opportunity to have these type of conversations and get a better understanding for why haven't you been vaccinated? Are you interested, first of all, in receiving the vaccine? So I have taken time to listen to those who have expressed that they have no interest in the vaccine, so to better
So
understand.
we've got a lot of work to do.
We have a lot of work to do.
Oh, good. Well,
a lot
we
of
have
work to
another
do.
guest that just walked in, Scarborough. Hey there, girl. How are you?
Hey there, how are you, Miss Barclay?
I'm doing fine. Listen, we were just talking about vaccination in black folk and minorities. It really should be Hispanic and black folk, right?
People of
How
color.
many people of color? People of color. So, what do you think about vaccinations and what's going on? Why African Americans are not inclined to get vaccinated? Why is there so much hesitancy with vaccinations?
Well, it's been difficult to get them. Now, I was not a person that qualified for the 1A or 1B.
Yeah.
And so it is my understanding that technically I would not be able to get it until beginning next Wednesday. But of course, I did the waiting line. So I waited in line for 3.5 hours
To get vaccinated?
to get my first shot. And there were some people that waited in line with me that turned away because they had run out of vaccine. There were some people that got tired of waiting that left the line, which enabled me to kind of move up in the line to be able to get the first shot. And so those are some of the challenges. Now, there are other challenges, like I was listening to you when I was coming in, and I think I heard Miss Marion say that, there are a lot of people that are just afraid. And I've talked to many of my friends that are just unwilling to get the shot. So that's a lot of what's going on with the African American community. You also have to understand too that the elderly who should be getting the shots and people with the multiple comorbidities, they often run into the issue of transportation and getting
Access.
to the location and access.
Right.
And so it's been very challenging. I have a family member who is a police officer, and he actually got his first shot after I did.
Well, wait a minute. Everybody getting the shots for dialysis. Okay, so we're looking at this 0.0018%. Okay? I mean, they have access. I would think, Ms. Wilson, that they have nurses that are just running around the dialysis units. Okay? So why haven't the National Kidney Foundation or one of those organizations got together to say, okay, we're going to make it our goal, okay, to get this 600,000 patient population that show up in the emergency room all the time, okay, that are immunosuppressed, okay, that go home to their family and to their caregivers and spread it. So why have they not focused on that population of patients that should be included? I know we were doing nursing homes, we're doing patients over 65. Well, a lot of our patients are 65, they're in nursing homes. So why hasn't this population of patients been targeted? What do you think?
Well, I think it would be the ideal would be to have the vaccine available for administration in the outpatient setting, because the patients are there, the healthcare professionals are there, and that group of healthcare professionals are already experienced with vaccine administration. So I think the idea is certainly something that would warrant further investigation. I think it would really have great impact.
You think so? Well, you have some data there that you were reading. Okay, you have some data I see in front of you that basically from one of the I think is it the United States Renal Data System? Can you read what it said on there? Okay.
Well, it says that utilizing the dialysis clinics is a good thing and something to be further explored. So I agree with that. I do think that there's an opportunity there for us to capture a group of patients that we probably wouldn't capture as quickly with the current system, vaccination system in place. I think utilizing the outpatient setting would allow us to expedite our vaccination efforts, certainly.
So, Scarborough, you mentioned to me earlier that everything evolves around money. Okay.
Yes, it
And-
does.
Yeah. And I guess what I'm trying to figure out here is basically you're saying everything evolves around money. Why is it then that they have not? Do you think that there's not enough revenue? Listen, first of all, are they getting paid to administer these vaccinations? Does anybody know?
Well, I know some of them do ask for your insurance information.
Okay.
Well, I looked it up, and the government is paying by the shot.
Okay.
So the first shot is worth one thing, and the second shot's worth another amount of money. I mean, I don't want to speak certain amounts because I'm not quite sure, but and then of course the one shot wonder, which is the J&J, that's worth another amount of money. So the people that administer them are getting paid, and in Texas is really interesting because.
So you're saying that there's motivation in volume, and in dialysis units there's no motivation because it's not volume.
Correct.
And I would also think that another important factor is availability of the vaccine.
They're saying it's available. It's available
now.
Okay.
But if you think back, because we just started to see a real emphasis in this area, and it started with our new administration.
Okay.
Prior to, we didn't see the same energy that we're seeing now.
Okay. But the energy is still not focused on dialysis patients. This is the issue. So you've got a population of patients, which people are making money off of. You have large dialysis chains. I'm trying to say, so they're making money off of dialyzing these patients. Not that it's not a goodwill effort, but they're making money. Okay. So it would seem to me that it would be in their best interest to get these patients immunized to keep them healthy. You know what I'm trying to say? Yeah. So listen, we're going to hear from one of my colleagues, word on the street. Her name is Simone, and we're going to bring her in and to take her input on things.
The distant history. For many people, it's recent history.
Okay.
So one, we have that, what I really consider healthy suspicion of medical profession.
I like that word.
I have always, anytime I've spoken to anyone, but particularly family members, friends, people that I encounter, even as you say, on the street, I always tell them that they have to be their own best advocates when they are dealing with any kind of health issues or any encounters with medical professions. I consider, as you say, I consider myself to be an informed person. And even I have had medical racism.
Okay.
I've experienced medical racism. So one, you have that historical element, and then you have just the mistrust of government. I mean, for me, I will say, personally, when they first came out with the vaccines, even I said, semi-jokingly, I'm not going to be the first in line.
Yeah.
I'm gonna see, let's see what happens to others. And then as I kind of did more reading on my own, the reality of the vaccines is that they're not FDA approved. They have an emergency use authorization.
Okay.
Which again, kind of gives people that impression of, well, we know that this was fast-tracked. I mean, we talk about it in the media, how this was, these vaccines were approved for use quicker than at any other time. So people hear that. So they know that there's something different about it. They just don't know what. And it's always the unknown. People have always been a little more reticent to do things when there's not that element of certainty. What we are certain about is the effects of the virus.
Right.
We know.
And we have bills to pay. We, as minorities, we have bills to pay. So,
And we have to,
we're at the front line. We get paid the less, but we're at the front line. We're the healthcare workers. We're the garbage collectors. We're at the front line. So basically, we need the vaccination.
we do need it, but I think the thing is, one of the issues that people have is they kind of look at what they're being told and they look at what happens. If you say that we are, as minorities, we're on the front line, we're service industry, we are essential people, and yet there's still this argument as to who is considered essential, who gets vaccinated first. So there's that part of people saying, well, you know what? I've been doing my job. I haven't been vaccinated. So what's the big whoop now? Why should I rush out and get it? So it's that dichotomy of you tell me that I'm essential, you tell me I have to do it, I have no choice but to work. We saw that particularly in the meat processing industry. That was a big issue early on in where workers were initially, they were saying we're going to close it down, and then we had leadership, we won't say who, but we had leadership to say, oh no, we got to have the meat processing, and these people had to go to work, and they were dying and getting sick by the hundreds. But then and then of course all the other, like you said, frontline workers, outside of the medical profession, just the frontline workers, the grocery clerks, the transportation sector. These are all people that are still waiting to get vaccinated, mind you.
Yeah. Well, I really hear what you're saying, but I think as in the world of nephrology, I think we can't afford to be passive, okay? Because these viruses are mutating, okay? And and I think what people don't understand is basically, they may not even understand what mutation means, So, Marion, when you talk about mutation, I think about some rodents, like some roaches. Basically, you put down pesticides, okay, and it might kill them for a certain amount of time, but after a while, those roaches just rise up and say, hey, I got you, I'm walking away. So you have to get another vaccination or another pesticide that will kill the next breed of them, So that's the danger, I think, in minorities not getting vaccinated, especially our dialysis patients.
I like something that Simone spoke about. I have to be my own advocate.
Okay.
And so I think there's an opportunity to provide education and information to individuals that are receiving the service so that they can use their voice and help further this cause and get this need addressed. I am actually excited about what I'm seeing so far in terms of the vaccine itself being made available, the real push from those that are in leadership roles to help excite people about this.
Yes.
That's very encouraging.
We have different levels of understanding.
Right.
And unless you have people oftentimes talking to dialysis patients like they're in a vacuum, you have to break it down.
Right.
Now, how many of us people that are scholars, that are educators, that actually break it down and take the time to do that? Do you understand what I'm saying, Simone?
One of my more recent experiences is when they are advocates and they ask questions, then it's also been my experience that sometimes, not often, they say, if you can't, what's that old saying? If you can't impress them with brilliance, you baffle them with, you know what?
Yeah. Yeah.
Yes.
Yeah.
And sometimes when
Simone knows
people
all the little sayings. I like that.
Well, Simone, I got one for you. If you want to keep a secret, put it in a book. So you the doctor, but everybody's not reading like you, okay?
Yeah.
I'm going to need my cornbread and my mustard greens, some chitlins. Now, see, if y'all were giving away some money, or you tied this to the tax returns or your stimulus, as they say in the hood, I'm going to need my stimulus money. If you said you get your stimulus money when you get your shot, we'd be lined up down the door.
Okay, so you telling me
absolutely. You get the shot because people understand that. They understand money. I understand money. And I got my shot.
That's right. But let's say, oh, you want your stimulus check? Come get your shot. You think we'd have a problem getting people out?
But why are we like that? Why?
Well,
Come on.
I
come
think
on.
that would be a problem with a lot of people. It may be somewhat. I'm just saying, it's just my stance. I'm sorry. I think that some people would be offended if it were presented that way. I think they may feel that.
Well, they offended by Tuskegee. They offended by. Come on now. Come on.
Well,
But that's a very valid concern.
Okay.
There should be. What was your word, Miss Simone? A healthy. What was that word you said?
Healthy suspicion.
A healthy suspicion. Yeah.
you know
Yeah.
what though? I'm so tired of this because, listen, when we went to elementary school, we couldn't get in the door without a shot record. You had to have every vaccine known to man. We asked people to wear masks. They get upset, but they wear their seatbelts.
Yeah.
So this is a matter of picking and choosing. And what's that man that we don't call that used to be
Yes, ma'am.
in the house up
Yes,
in
ma'am.
D.C.?
We're not gonna call him here today either.
Right. He has divided
Wait.
opinions.
He who shall not be named.
Right.
Okay.
But he's
okay.
divided opinions, and people unnecessarily have opinions. I mean, the science and the technology that's behind the vaccine, it's no question about it. They've even gone as far as to say that one of the vaccines was invented by an African American woman.
Oh yeah, Moderna.
That's the
Moderna.
one I got.
So I don't know what else we can tell people.
Yeah.
Right.
Now, if people are on dialysis and they're not getting their shots, I'm gonna blame the doctor.
No. Okay.
No.
Why would you blame the doctor? Why? Okay.
Because
we're gonna hear her out, Miss Wilson.
Okay.
I'm gonna need him to encourage his patients to get shots. And if he's not encouraging his patients and trying to facilitate a location where they can get shots,
Yeah.
I mean, we're talking about sick people.
Right, but
Okay.
there are a lot of doctors that will tell you that they tell their patients to get the shot.
Absolutely. I've
but if the
witnessed
shot
it,
is
yes.
not made available in the dialysis units, okay, this is my issue. You can get it to these large hospitals with large volumes of people, but you're talking about 0.0018% of the total patient population of patients that's on dialysis, and you cannot get the shots at the dialysis units for the nurses who are already there administering the procedure to give them the shot. Oh, come on. Are we saying doctor or are we saying government?
Are we saying that there's been no effort by facilities to get the shots into the facilities?
Well, basically what I'm reading here. Okay, Simone, what's your take on that? Let me find this piece of information that I
That's
had.
an
that
interesting question. I
Here's
like that
my
question,
thing.
Ms.
I
Stover.
think one of the issues is we're trying to make this proactive, and people don't always respond when things are proactive. People tend to respond more, unfortunately, when it's prohibited. And that's how we got the mask working. We said, okay, you don't have to wear a mask, but you can't go grocery shopping. You can't get your essentials.
Yeah.
You can't do anything unless you wear the mask. And maybe we should kind of switch it around where it's like you have a freedom not to get the vaccine. But if you don't get the vaccine, you can't get your benefits. You can't get other services. And so it's your choice. We're not taking your choice away. We're simply saying that for the benefit of society as a whole.
Well, you may not.
And you can't get your stimulus check either.
Okay. Well, if you roll up on Miss, but Miss Wilson, if you roll up on me and you didn't have your shot, I consider that a death penalty. Okay, get
But
back.
how would you know whether or not
We're looking at this wrong.
Okay,
We're
okay.
giving people too much choice. You need to narrow the choice down, make it very simple. And it's very something that you guys once said, you have to break it down. And sometimes you break it down by making it more a prohibitive thing. We say, okay, you can choose not to do this, but you become a drain on the healthcare system because you
Yes.
run the risk of getting sicker.
And
so
that's
fine.
That's true.
That's your choice.
I have a
But for the
doctor.
rest of you, yeah.
It says here, one of the studies from the United States Renal Data Systems, System 2020 Annual Data Report, patients on dialysis should receive priority in light of studies showing that individuals with kidney disease are far more likely than the general population to require hospitalization, like you just mentioned, Simone. You know, if they contract COVID-19, even when compared with individuals older than 65 years old, and this is a Dr. 𝐦𝐚𝐬𝐬. Okay, so I guess I'm wondering why we keep pushing and pushing and pushing. Why isn't the National Kidney Foundation doing more? What do you think, Ms. Wilson?
Well, I think, again, I go back to the fact that the availability of the vaccine, I think, is a big factor.
It's available.
It's being addressed.
Okay.
It's being addressed.
Okay, it's available.
You know, so that's a big thing. And I think there's an opportunity to inform the dialysis community of the concern that's there, the concern that you've raised with the low number of individuals that have been vaccinated.
Right.
And encourage.
So you're an entrepreneur.
Yes.
You have the dialysis unit. Okay. So answer this question.
Yes.
How many people have you seen come into your unit, push and say, okay, or call you? Have you received any calls from CDC or anybody represented? That's my issue.
Yeah,
Okay.
yeah.
They know what these units are. They know exactly because you're looking at what? The Medicare budget is 15% of the national budget.
Yeah.
And you're looking at renal patients, dialysis patients take up about 7 to 8% of that budget. That's pretty high.
Yeah.
Don't you think that that's a population of people that we should be focusing on?
Now, yes. I think that because this is all so new.
Oh, come
and
on.
Listen, just hear me out.
Listen, Linda.
But because this is so new and we're learning and we have a new energy in terms of our leadership now.
Correct.
The emphasis has shifted.
Okay.
And I think that with time, I think we're going to see things shift.
Right.
I really do.
And
I think
the
it's gonna
emphasis
take
has
some time.
shifted and people are still dying. So this is not, with dialysis patients, I feel like this is emergent. What do you feel, Scarborough?
Well, Miss Miriam is being so nice. I just thought I'd give her a little scratch for that.
You give a little smack.
I'd give her a little scratch.
I'll take it.
Yeah. Well, I still think that I think the problem is getting better.
Yeah.
Because the number of vaccines that are coming out and the availability on the market.
Yeah.
I just think that it has to be targeted to the people that need it. And it's just amazing to me. Now, I'm a news watcher of certain channels.
Okay.
And what I can see is that all of those who indicated that the virus was not real or what have you were the first in line to get the vaccine. And you know, it wasn't really the people of color that were getting the vaccine. It was almost like they were running us over, pushing us out the way to get the vaccine.
Yeah.
Now, I'm going to just tell you, while I'm getting ready to get on my soapbox
your
here,
soapbox,
I'm going to have to give myself a hand clap. So if won't nobody clap with me, I'll clap for myself. There you go.
Okay, so Simone, you're out on the street. Okay, have you heard anything within the African American community or Latino community about churches? You know, churches should be pushing that as well. You know, we go to church and we trust God for everything else. Okay, have you heard? What's your take on that, Simone?
I haven't heard how the churches are trying to coordinate efforts. I agree. Historically, again, that has been our center, our social center.
Yes.
You know,
Yes.
so, but then, you know, unfortunately, it's been my experience when it comes down to information, that becomes a political. It shouldn't be politicized, but it is.
Okay.
You know,
Okay.
and that's where you end up who gets the credit, because unfortunately that is also one of the cornerstones of the church. There's been an element of politics there. So speaking from experience,
Yeah, yeah,
I worked with a program once where we were working with the seniors,
yes.
and it was for caregivers of dementia patients. And we were trying to get the information. It was a sponsored program, so it was free, but trying to get the community, the religious community, to work together was almost impossible because it was a matter of who's getting the credit, who's getting recognized for their efforts, as opposed to it being a group project and working for the benefit of the community. And that you're going to run into that same problem.
I'm like Millie Jackson. What did you say? Salvation is free, so the vaccinations are free. Okay.
Vaccination.
Well, I think that Miss Simone needs a hand clap because she said that so eloquently.
Okay.
Now, Miss Simone, it seems like I'm the one that just has to tell it like it is.
There you go.
So
Okay.
let me tell you, we can't even get the church to get people to go vote if it's
come
not
on
in their
now.
self-interest.
Yeah.
You
on
know,
now.
now the church is, everybody,
gonna have
you
to
got
have
some
some pastors
prosperity
on the
gospel and a
podcast.
whole bunch of other stuff,
Yes.
but they only interested in themselves. And if it's not what's in it for me,
Yes.
Miss Scalper.
then it's
They're
not
not gonna
happening.
let you back in the church.
Oh my God.
You know what? You know what though?
This fellowship, her. She gonna be this fellowship. Okay, she gonna be this fellowship.
Well, you know what? They don't have to let me back in because during this pandemic, everybody's been at home
Yeah.
watching TV on all of these various cell phones and devices. So I have officially joined Bedside Baptist
Oh,
Church.
amen.
Where
Come on,
sister, the pastor, and so I'm perfectly
Do
fine.
you put your hat on?
That's right.
Do you put your hat on?
Okay. All right. So let's get back to the dialysis patients.
Yes.
Okay.
Sorry.
So
They
I
at
guess-
bedside too.
Okay.
Bedside, on-side.
So we're gonna wrap this up. So
This is
I just want
fun.
everyone to have a in conclusion, okay, give me a final analysis of what you think should be done, Marian,
Well,
as
I
far
think,
as
I think
getting the word
that-
out to dialysis patients and getting our government to recognize
Yeah.
this is the population of
Yes.
patients that need to be dialyzed.
Well, first, I want to applaud you for creating this platform. I think this is an excellent means of being able to share information with people.
Yeah.
And in the outpatient setting, this gives people an opportunity to listen to something that's going to enlighten them. So I
Yeah.
think this is a big step towards helping to
People have a
impact.
voice.
Yeah, yeah. And I also think that as healthcare professionals, we can share information. I have a captive audience.
Okay.
Monday, Wednesday, Friday,
Okay.
Tuesday, Thursday, Saturday.
Okay, okay.
For about 4 hours. I have a
Okay.
captive audience.
Okay.
So I and others that work in the outpatient setting, we can use that time to impart information
Right,
and
right,
encourage
right,
people.
right.
So again, I applaud you for creating this platform. I'm excited.
Okay. All right. Miss Scarborough.
Well, next time I come back, are you gonna have lunch for me?
See, you know what? Okay.
I really hope that the dialysis patients
Yes.
do recognize it in their self-interest to get vaccinated.
Yes.
I hope that the doctors and the nurses that care for them on a weekly basis
And other organizations like
and other organizations begin to encourage them more
Yes.
and educate them about the vaccination, why it's good for them, and give them material that should be free to let them read for themselves about what this is about, because the vaccines are safe and we want to keep them around a little bit longer. We didn't talk about me, but my day job is actually doing some electronic stuff for the deceased.
Okay.
And many of them have passed away from COVID. And so you have a lot of people that are saying it's not real. And I can tell you that I've streamed and done some things for some that are 30,
Yes.
40.
Yes.
And so this virus is it's not partial to age.
No.
It will take anybody. And the weaker your immune system is, as with the dialysis patients, the more susceptible you are. So I hope that the listeners will really think about some of these things and begin to explore and really think about changing their minds and opinions.
Okay, Simone.
Yeah, well, I think I was listening to the other participants, and I think everybody has their finger on the pulse. So the key word is collaboration.
Okay.
I think that's huge. I think, like you said, starting this is a good step. Again, I use one of those little witticisms. What did they say? Brighten the corner where you are.
Right.
I think I think one of the things that you can do is people tend to respond to people who are similar to them.
Yes.
So if you get people who are already on dialysis and who are taking the vaccine,
Yes.
who have already taken the vaccine, find those people
Yes.
and
Yes.
start letting them be the
Yeah.
grassroots.
Yes.
Start a grassroots movement within the dialysis community.
Yes. Yes.
Because people, if you've gotten it and you're on dialysis, I'm much more likely to listen to you than I am someone who doesn't have the same experience.
Okay. Okay. Well, thank you guys. Very good program today. I think we're going to continue this next week. Really enjoyed the conversation. This concludes our episode of Kicking It with Kidneys. See you next week.
Well, that's it for today. Thank you for listening to Kicking It with Kidneys with your host, Cindy Barclay. See you next week. The views expressed on this podcast are educational and opinion-based. These are not medical doctors.